One day I came across the Insider and it was just right there on the front page. Pride ERG is having a meeting.
I was a new employee at the discharge pharmacy. A nurse was coming to pick up discharge meds and just out of the blue was like, "You're new here." And I was like, "Yes, I am." And he was like, "Are you in the Pride ERG?"
I was seeking community for myself as an LGBTQ identified person, and I really wanted to find more opportunity to connect with peers.
I started seeing more activity and communication about Pride events. The Pride March and the month of June is that time that I just can turn up the celebration just a little bit more.
Pride makes me feel like I matter.
Living loudly and without fear.
Coming to work and being in a place where myself and my family are not only accepted but embraced.
Being able to be proud of yourself is deeply connected to belonging.
Things feel different for us. We've had to do a lot more work. We've had to look in. We've had to process more. A lot of us have had really hard lives, and that takes work, and we've persevered, and so we have to celebrate that.
It's a time of celebration, but it's also a time often of remembrance, realizing where we've come from and where we're going, and a time for the larger community to come together and really kind of embrace the LGBTQ community and continue to, hold us and elevate us to a space that just feels amazing.
As a trans patient myself, I know that it can be extremely vulnerable and scary to get access to healthcare.
Healthcare institutions have an opportunity to train their workforce and develop environments that feel safe for people to participate wholly as themselves and get the best, highest quality care possible.
We try to alleviate pain and suffering. We try to bring forward love and care, kindness. That's intrinsic to healthcare.
My goal is for every trans patient that comes to our institution feels comfortable and feels safe.
The services that we can provide here are ones that can improve and elevate health equity.
I think it's critical for an organization like ours and many organizations to have employee resource groups. It's a signal to people that we care about the specific aspects of their lives that have made them who they are.
The Pride ERG, along with all of the people there, provided some direction and provided a lot of support as I was navigating really new waters.
We want people coming forward representing different lives.
You can tell immediately when you walk in the door if it's a place that you feel belonging, it's a place where you feel safe.
Our patients, their families, our communities should see that we bring forward diverse perspectives, and I think employee resource groups are a form of us making sure that that signal is clear and is seeable and seen.
In the climate that we're in, people of all sexual orientations and identities are wanting to join this drumbeat that we have going. And it's really meaningful, it's really significant to have colleagues and allies show up in that way.
The theme this year, We All Belong, resonates with me because every single person matters. Nobody's invisible.
Not having to code switch, not having to turn off part of yourself, not having to filter how you're answering questions. And that's really essential to a workplace that can uplift and support and innovate and do the type of work that we're trying to do at UC Davis Health.
Saying we all belong is not just words, lip service. It is really a sense of the space and the culture that we hold for each other in all ways. LGBTQ plus community, but for all communities. Those earlier years with Pride March attendance was much smaller than what our presence is now, which I believe can extend multiple city blocks and hundreds of our employees.
We see every person that's there, we greet people, and that just brings so much joy to me.
I love actually being part of it.
We marched in our first Pride, and we had a sign that was a picture of us. Everyone high-fived us, even people in the audience high-fived us. They were excited that UC Davis was there.
It wasn't accepted in the beginning with both our families, so it took a while for them to warm up. It's been a long journey, definitely.
And now I feel like my mom loves her more than she loves me.
Yeah. I just feel it's important that we do show that this is normal to people.
It is probably one of the most fulfilling experiences to both be present, supported, as well as be that for others.
We show up because if not us, who?
What you give, you get back. You know, double, triple fold. I've just had amazing opportunities, door after door that's been opened for me to walk on through.
I want everyone to just respect and empower each other, no matter where we're coming from.
I am who I am. This is how I was born. This is how I was raised. This is how my family supports me, coworkers. And I just feel like UC Davis embraces that.